milligrams per deciliter, okay?
100?
If you did eat, if anything under 140 would be considered okay. If you did eat food, then you got your glucose test.
Yeah.
Okay. Where we left off before we cut ourselves short is I'm gonna want all of you to take one cartridge each because at some point before we end, I'm gonna go over all these lab values with all of you. But just to make it very quick and remember, just to recap, you're going to scan the barcode, right? You scan the patient, you scan the barcode, right? And then you're able to get the cartridge. Quinn, can we stop so we can finish? And then you need to be able to drop blood. You get the blood from the arterial line, you know, your art line transducer, the little plunger. Quinn, can I have you come over here? Because it's disruptive. And then you're going to insert this cassette, or this little diskette, into the back of the device. And you want to be able to fill the blood where that arrow is.
Oh. There's
a little hole here, and you're going to use your syringe to be able to put the blood inside here, enter it in here. At no point should this device have contact with the blood, okay? There might be, but then that's why you have to sandy wipe this when you're done, and it'll give you a result. So activated clotting time, really quickly, does anyone know what that is? What is the purpose of finding the ACT number of the patient?
See how quick they're clotting? They could stop. They can what? They can clot their own.
So
Bleeding out.
ACT is activated clotting time. It will give you a value in seconds. It will tell you how many seconds it takes for the patient's blood to clot. The reason why is they need to know if they need to give anticoagulant they need to give them, anticoagulant in patient. If there is issues with their clotting, do they need to give them clotting factors? And so cardiac surgery will use this, liver transplant surgery, they will use this. And then once this goes, this can be tossed away, okay?
So it's only clotting purpose.
Activated clotting time, that's all this does, okay? And then this one is CG4, and the way you know what it does is it tells you in the cartridge, pH, PCO2, PO2, lactate, HCO3, TCO2, BeSO2. You have no idea what this is. I'm going to go over it with all of you.
Yeah.
Okay?
Are
So,
these things accurate?
I'm sorry?
Are they accurate?
So, it depends on what you're comparing it to, but yes, to some degree they are accurate. However, I do know of an anesthesiologist is actually doing a study to compare the results of this with the results of the blood gaps. Like the lab tube you give to the lab and they run it, they're going to compare the numbers, okay? So this one is another one. Remember, this one is 2 months. It expires from the time that you remove it from the fridge. I take it off today, November 12th. So December 12th, January 12th, 2021 is this one is good for, okay? If it's been in the refrigerator, sitting, actually it's not good because it expires December 11, 2020. Then this would need to be used before this expiration date. I remove this, take this out. It looks the same concept.
Well, what says what we learned in that class is that we're not supposed to touch around at the top of it. It should be on the side of it because it can ruin
the reading. Yes. So CG4, pH, PCO2, PO2, lactate, bicarb, base excess, and oxygenate, SO2. So you'll be able to get a reading from the CG4.
So what is CG4, CG8?
That's just the model.
Yeah, just
like
the name.
Yeah, it's
It's
just
different, to know just, it's different tests, right?
Right. And this one's called CG8. 2 months. It says CG4, CG8. CG8, just think of CG8, it has the most lab values that you can get an answer. Okay, this one does pH, CO2, PO2, sodium, potassium, calcium, glucose, hematocrit, bicarb, base excess, oxygenation, and hemoglobin. So CG8, you can get all the lab values with this. Okay.
And so where do they keep these devices?
In the
In our
fridge.
workroom. So we have a refrigerator in our workroom. Oh, this is in our workroom. Here.
Don't the
in-
nurses have them in the OR sometimes?
No, not all of them. Yeah, we manage the ISTAT. Cath lab and cardiac, they have their own in their nursing station or in their core. But all the other rooms, like, see this, how did this end up here? This is room 33, 500p. And these are about $11,000.
Wow.
What the? Wow.
So what I want you to do is, be able to take one of each.